In 1978, a lady with the complaint of mastitis, a painful breast infection that had persisted for over a month. She had already undergone 2 rounds of antibiotics, but each time the medication ended, the infection returned with even greater intensity. Despite her ordeal, she continued to breastfeed, determined to care for her child. The pain was overwhelming, radiating from her breast throughout her entire body. She was desperate for relief, and I could sense her exhaustion and frustration. On examination, her right breast was inflamed, with a vivid red streak running along its side. The area was extremely tender to touch, and she had a fever of about 101 degrees Fahrenheit. The infection was not only persistent, but also worsening, despite previous treatments. She was in significant pain, and the emotional toll was evident. As a new practitioner, I felt the weight of responsibility. I knew that if left unchecked, mastitis could escalate into a more serious condition, such as a breast abscess. The situation was urgent, and I needed to decide on the best course of action for her. After taking her case using the homeopathic system, I decided to prescribe Phytolacca 30C, a remedy known for addressing mastitis. At the time, I was inexperienced with such acute infections and felt uncertain about relying solely on homeopathy. The conventional wisdom would have been to continue antibiotics, but the patient was adamant she wanted to try a different approach. She was tired of the recurring cycle and was willing to trust the homeopathic method. I instructed her to call my office the next morning to report her progress, feeling both hopeful and anxious about the outcome. That night, I lay awake, filled with anxiety and second-guessing my decision. Was it irresponsible to treat such a serious infection homeopathically? I worried that the patient might have deteriorated overnight and perhaps ended up in the emergency room. The weight of my inexperience pressed on me, and I questioned whether I had made the right call. The uncertainty was overwhelming, and I could only hope for the best as I awaited news the next morning. The next morning, I arrived at the office early, eager and nervous to hear from my patient. Without waiting for her call, I reached out to her directly. To my surprise, she answered cheerfully. She reported that the homeopathic remedy had worked her pain, fever, and all signs of infection had vanished overnight. I was astonished. Could such a dramatic recovery really happen from a single dose of homeopathy? I tried to maintain my professional composure, but inside I was filled with disbelief and relief. From that moment, I looked at homeopathic remedies with newfound respect. I had not believed it possible for such an acute infection to resolve so quickly, especially after conventional treatments had failed. When I saw the patient again a month later, she mentioned that the infection had started to return a week after the first dose, but a second dose of the remedy kept her well. This experience was transformative for me as a practitioner and deepened my commitment to individualized, patient-centered care. This remarkable cure was not an isolated incident. As I gained more experience in homeopathic prescribing, I found that such outcomes became increasingly common. The key was individualizing treatment, seeing each patient as a unique whole, rather than just a collection of symptoms or a diagnosis. This approach allowed for more effective and lasting healing, and it challenged my previous assumptions about what was possible in medicine. Let's step back and consider how our perspectives shape our understanding of the world. Few people today believe the Earth is flat, yet for centuries, this was the accepted view. Everyday experiences like watching the sun set or seeing water lie flat reinforce the illusion. It took a radical shift in thinking to accept that the Earth is actually a sphere. This shift didn't make the flat view useless. It simply revealed its limitations and placed it within a broader, more accurate context. In the past, science, religion, and common sense all supported the flat Earth model. When the spherical Earth theory emerged, it was met with resistance and confusion. People could not grasp the new perspective as long as they evaluated it through the lens of flat earth thinking. Eventually, the conflict was resolved when people realized that the flat view was simply a limited perspective within the more comprehensive spherical view. The technologies developed for a flat earth still worked, but their usefulness was now understood to be limited. A similar conflict exists in medicine. For over 200 years, two fundamentally different perspectives have shaped healthcare. The conventional approach focuses on treating diseases, while homeopathy, introduced by Samuel Hahnemann, emphasizes treating the patient as a whole. Hahnemann's theory was a radical departure from the accepted view, proposing that disease is a process affecting the entire person, and that medicines can stimulate the body's natural healing in small, non-toxic doses. Conventional medicine classifies drugs according to the diseases they treat: anti-inflammatories for inflammation, antibiotics for bacteria, and so on. The focus is on the disease, not the individual. In contrast, homeopathy seeks to stimulate the patient's own recuperative processes. The same disease might require different remedies for different people, and the same remedy might be used for many different conditions, depending on the patient's unique characteristics. Despite being over 2 centuries old, homeopathy remains unfamiliar to many. It is, however, a highly developed science practiced worldwide. The idea of treating the patient, not just the disease, is still revolutionary for most people. Yet, as more practitioners and patients experience its benefits, the homeopathic approach continues to gain respect and recognition. Conventional medicine can be seen as flat earth in its approach. It treats health problems from the perspective of the disease, not the patient. Just as the earth appears flat to the naked eye, it appears that treating diseases is the same as treating patients. But this is not the case. Homeopathy offers a more comprehensive perspective, encompassing the disease approach within a broader, patient-centered framework. Just as the spherical earth view encompasses the flat view, the homeopathic approach includes and transcends the conventional disease model. The treatments developed under the disease model still work, but only within their limited scope. To truly understand homeopathy, one must adopt a new perspective, one that looks beyond the surface and considers the patient as a whole. After graduating from the National College of Naturopathic Medicine in 1978, I spent years practicing in Southern Oregon. My work included running a home birth program, delivering babies, treating mill workers with spinal manipulation, and offering nutritional therapy and herbal remedies. Each modality had its place, but homeopathy remained my passion. I used it for patients of all ages and for a wide range of conditions, from simple colds to chronic arthritis and acute infections. Through years of practice, I learned that all forms of healing have their place. Homeopathy, however, stands out for its safety, effectiveness, and clear principles. It is a system that respects the individuality of each patient and seeks to stimulate the body's natural healing abilities. This approach has earned my enduring respect and commitment. Not everyone shared my enthusiasm for homeopathy. Local medical doctors reacted with a mix of respect, wariness, and sometimes open hostility. Some refused even to speak with me, citing medical ethics. This resistance highlighted the deep divide between conventional and alternative approaches and the challenges faced by those who seek to broaden the scope of healthcare. Despite the skepticism, I remained convinced that every form of healing has its place. The needs of the patient should determine the approach, not rigid adherence to one model. This philosophy guided my practice and helped me serve a diverse range of patients with varying needs and preferences. It's important to acknowledge the successes of conventional medicine. Deadly diseases like pneumonia are now routinely treated with great success. The disease-oriented model has brought significant advances and saved countless lives. However, it also has limitations that can leave many patients feeling unheard and untreated. Imagine Mrs. Jones, who feels terrible but whose tests show nothing wrong. Her doctor, Dr. Smith, suggests antidepressants. But the real issue is that without a clear diagnosis, conventional medicine offers no treatment. This highlights a major flaw. Patients can suffer for years before a diagnosable problem emerges, and their symptoms are often dismissed or minimized. Even when a diagnosis is made, it isn't always correct. Studies show that physicians' diagnoses are accurate only about 50 to 75% of the time. If the diagnosis is wrong, the treatment may be ineffective or even harmful. This uncertainty can leave patients feeling frustrated and vulnerable, and it underscores the limitations of a disease-centered approach. Consider Jimmy, a child with a persistent cough. His tests indicate a viral infection, for which antibiotics are ineffective. Dr. Smith admits that there's little he can do, but sometimes prescribes antibiotics anyway, hoping for improvement. This scenario is common. Many conditions have no effective treatment in the conventional model, leading to overdiagnosis and overtreatment. In many cases, patients recover not because of the treatment, but in spite of it. Conventional physicians may prescribe medications that offer little real benefit, simply because there are no better options. This can lead to unnecessary side effects and increased healthcare costs, without truly addressing the patient's needs. Take Carol, a child with frequent ear infections. Her mother is frustrated by the high cost of repeated treatments and asks Dr. Smith for a solution. The doctor suggests ongoing antibiotics or surgery, but these approaches do little to prevent future infections. The underlying susceptibility is rarely addressed, resulting in a cycle of recurrence and temporary relief. For many patients, the disease approach creates a revolving door experience: treatment, recurrence, treatment, and so on. Each episode is treated as a new problem, rather than as a sign of ongoing susceptibility. This cycle can be frustrating and costly, and it often fails to provide lasting relief or real healing. Most conventional doctors, like Dr. Smith, are sincere and dedicated to helping their patients. However, the limitations of the disease model mean that even the best intentions can fall short. Patients may not receive the comprehensive care they need, and the focus remains on managing symptoms rather than addressing root causes. The disease model also brings other problems, such as drug side effects and adverse reactions. Overuse of antibiotics has led to increasing bacterial resistance, making some infections harder to treat. These unintended consequences highlight the need for a more thoughtful and individualized approach to healthcare. Modern healthcare is increasingly expensive. The disease model relies on sophisticated technologies to diagnose illnesses with greater certainty. While a few patients benefit from these advances, most undergo costly evaluations that often yield little useful information or reveal conditions for which no satisfactory treatment exists. When the disease model is promoted as the only viable approach, it becomes more than just a model. It becomes a fixed, flat earth view. This mindset can blind practitioners and patients alike to the benefits of other perspectives, limiting the potential for true healing and innovation in medicine. Homeopathic physicians have always recognized the value of surgery, nutrition, and other healing modalities. The goal is not to reject conventional medicine, but to integrate it within a broader, more flexible framework that prioritizes the needs of the patient. This inclusive approach offers the best chance for comprehensive and lasting health. Relying exclusively on the disease model carries risks that many people do not fully recognize. By focusing only on treating diseases rather than patients, we miss opportunities for deeper healing and may expose patients to unnecessary harm. A more holistic, individualized approach can help mitigate these risks and improve outcomes. Just as the spherical Earth view expanded our understanding of the world, a patient-centered approach in medicine broadens our ability to heal. By seeing the patient as a whole, Rather than just a set of symptoms, we open the door to more effective and compassionate care. This shift in perspective is essential for the future of healthcare. Our beliefs and assumptions shape the way we interpret the world. In both geography and medicine, shifting to a broader perspective can be challenging, but it is necessary for progress. Recognizing the limitations of our current models allows us to grow and adapt, ultimately leading to better outcomes for everyone. Homeopathy teaches us to see the patient as a unique individual, not just a diagnosis. This approach requires careful observation, empathy, and a willingness to listen deeply. By focusing on the whole person, we can uncover the root causes of illness and tailor treatments that support true healing. The essence of homeopathy is to stimulate the body's own healing processes. Rather than suppressing symptoms, homeopathic remedies encourage the body to restore balance and health. This gentle, non-toxic approach can be effective for a wide range of conditions, and it empowers patients to take an active role in their recovery. A homeopathic practitioner serves as a guide and partner in the healing process. By building a trusting relationship and understanding the patient's unique story, the practitioner can select remedies that address the underlying causes of illness. This collaborative approach fosters better outcomes and greater patient satisfaction. Over the years, my experiences with homeopathy have taught me the value of keeping an open mind. Each patient and each case is an opportunity to learn and grow as a practitioner. The more I practiced, the more I saw the remarkable potential of individualized care and the limitations of a one-size-fits-all approach. True progress in medicine comes from integrating the best of all approaches. By combining the strengths of conventional medicine, homeopathy, nutrition, and other modalities, we can offer patients more comprehensive and effective care. This integrative model respects the complexity of health and the individuality of each patient. To move beyond flat earth medicine, we must be willing to question our assumptions and embrace new perspectives. This means recognizing the value of treating the patient as a whole and being open to approaches that may seem unfamiliar or unconventional. The future of healthcare depends on our ability to adapt and innovate. Patients play a crucial role in their own healing. By becoming informed, asking questions, and participating actively in their care, patients can help shape their treatment plans and achieve better outcomes. Empowered patients are more likely to experience lasting health and satisfaction. The future of medicine lies in embracing diversity and flexibility. By valuing both conventional and alternative approaches, we can create a healthcare system that is more responsive, compassionate, and effective. This vision requires ongoing learning, open-mindedness, and a commitment to putting patients first. Progress in medicine depends on our willingness to remain open-minded and curious. By exploring new ideas and approaches, we can continue to improve the quality of care we provide. The journey beyond flat earth medicine is ongoing, and it requires the participation of practitioners, patients, and the broader community. In summary, the journey beyond flat earth medicine is about expanding our perspectives and embracing a more holistic, patient-centered approach. By recognizing the value of all healing modalities and focusing on the needs of the individual, we can create a more effective and compassionate healthcare system. The lessons of history remind us that progress often requires challenging old assumptions and being open to new possibilities. Change is never easy, but it is essential for growth. By moving beyond the limitations of the disease model and embracing a broader, more inclusive perspective, we can offer patients the best of both worlds. The future of medicine is bright for those willing to look beyond the horizon and see the whole picture. As we move forward, let us remember that true healing comes from seeing the patient as a whole and being open to all possibilities. By integrating the best of conventional and alternative medicine, we can create a healthcare system that is truly responsive to the needs of each individual. The journey beyond the flat Earth is just beginning, and the possibilities are endless.